So our next speaker is Dr. Helen Redmond. Now, Helen works as a rehabilitation physician and also a lecturer at the School of Public Health and Community Medicine at UNSW. And she's been an active member of Doctors for the Environment since 2006 and is one of the vital members of the DEA Management Committee as the current New South Wales representative and also the chair of the divestment committee. And I invite Helen to speak to talk about the unconventional gas influence on the environmental determinants of health.
Thank you. Thank you, Alice, and thank you, Kate, and everybody for inviting me to speak. It's a big honour to be here. I was actually the bunny that was in the road of the very first invitation to DEA to speak on unconventional gas. So back then we didn't have a lot of literature. There was literally only one paper that was about to be published on drilling and fracking chemicals from the US, and there was a couple of reports, and there was stories coming out of the US. Case histories of people being unwell and so on. So there wasn't a lot to go on. And I look back on that talk when I was preparing for this one, and it's remarkable how correct it was in identifying all the risks of this industry. And I could actually have just given you that talk, but lucky for you, I decided I'd write a new one. So now we refer to it as unconventional gas, and it's the three types. It's coal seam gas, shale gas, and tight sands gas. They all have the same environmental and health risks, no matter what you hear about one being safer than the other, and usually those messages are from industry. They're unconventional because these are gas resources that are of low permeability. They don't give up their reserves of gas easily, and you require many, many wells spread over a large area and specialised techniques such as hydraulic fracturing, horizontal drilling, in-seam drilling, and so on. Otherwise, it's not commercially viable gas. So the most controversial of those techniques is hydraulic fracturing, also known as fracking, and that basically means cracking rocks with water. That's what they do. So they pour down at high pressure large volumes of water, sand and chemicals to create pathways for the gas to flow back out. And the industry, as you know, has been rapidly expanded in Canada and also the US, and it's been credited for US's emerging energy independence. Also Australia, with coal seam gas starting first off in Queensland, with New South Wales and Victoria following, but as well we've got very large shale gas deposits, and they're rapidly being deployed in South Australia, WA and the Northern Territory. We've also got 3 enormous LNG export ports almost ready to go in Queensland, because this gas is not for us, it's for the export market. And DEA has been one of numerous medical and health organisations that has been voicing their concerns about this industry, both here and overseas. There's actually a lot more than that's on the slide. But not only health groups, rural and urban communities that are actually facing these companies coming in and commencing work in their area have come out very powerfully against unconventional gas. They get the threat, they get it, that this industry poses to their lifestyle and their communities and their landscape, and they know that they don't want it. So before we take a look at all the threats, I'm just going to tell you something you already know about health. This is the definition of health from the WHO, and I'd also like to show you this. I know it's a bit small, but there's been growing awareness of the social determinants of health in the last few years. So there's social and economic factors that determine people's health, like whether you've got a job, whether you're facing discrimination, whether you can access health care, have good living conditions and so on. But outside those things, you can see the natural environment global ecosystem, and that's where the environmental determinants of health lie, and they're bigger, they're more encompassing, and they are clean air, clean water, safe food, some contact with nature, and a stable climate. And this is where the interface lies between environment and health, and it's the area that DEA works in all the time. So unfortunately, an unconventional gas industry threatens every single one of these determinants of health. I'm just going to run through the risks for you. Water's got to be sufficient in quality and quantity. Water quality can be threatened by the chemicals used in drilling and fracking fluids, and also by the chemicals mobilised from deep underground. And those ones include heavy metals, radioactive isotopes, volatile organic compounds, including the carcinogen benzene. Drilling and fracking fluids contain carcinogens, irritants, sensitisers, a whole range of things, and they're associated with, they can cause harm to health if the dose and the exposure are sufficient. And there are hundreds of different products that are made for the industry containing lots of different chemicals. And if that's not sort of worrying enough, two other things are of concern. One is that for most areas, there is no compulsory declaration by the companies of what the chemicals actually are. So the companies can use these things and they don't have to be assessed or anything. So only 4 of the commonly used fracking chemicals in Australia, for example, have been looked at by our chemical regulator. But actually none of them have been specifically looked at for fracking. And you have to understand that a lot of this water and the chemicals associated with it can stay underground between 20 and 85%. The other problem is that the fracking process itself can create connections between the gas formation and groundwater that might be used for beneficial use. Also, in terms of on the supply side, there's been documented cases of water bores that are used in agriculture, levels dropping after coal seam gas activity in the area, and this is likely to be to do with a change in pressure and altered dynamics in terms of the way that water is flowing underground. And a bigger threat to water supply is actually the volumes of water that are used for fracking. So in one estimate, we've got 300 gigalitres being extracted from the Great Artesian Basin, which is a very important source of underground water for agriculture in eastern Australia. And that would be on top of 540 gigalitres already withdrawn from that water resource every year. So it's a massive increase. More than 50% more, just for this one industry. Then wastewater is also an issue, and it contains residues of fracking and drilling chemicals and things that have been mobilised from underground, and including large amounts of salt, which naturally occur in these reservoirs. And one estimate is that 31 million tonnes of salt will be produced by the industry over the next 30 years. And that's enough to fill the MCG 15 times to the brim. So that's a big waste problem. And, you know, you can't sell the salt and put it on your table because it's got contaminants in it. Wastewater needs to be disposed of, and they evaporate it in ponds, or it gets reused on site. It can be sprayed on roads to keep dust down. It can also be diluted and used for irrigation, and it may not be treated before some of those things. So it's a big problem in terms of contamination. Okay, so moving on to air, this is probably the most common exposure pathway for humans living and working near gas operations. But research is really hampered by the lack of environmental monitoring that we've got. So During extraction, unconventional gas may release fugitive emissions of methane and VOCs from produced water and fluids and so on. And also there's a lot of diesel emissions from vehicle movements and equipment. And that can combine to create ground level ozone, which, as we know, is a health hazard. And in fact, ozone levels have been measured in some gas fields greater than the sort of worst day of smog in LA. So it's quite a significant problem. In terms of food, both food safety and security can be at risk. There's a very large surface impact for this industry. It's very disruptive in terms of trying to farm the same land. There's a lot of crisscrossing roads and well pads. The roads all have to be 6 metres wide. There's pipelines that are on the surface. And so it's very difficult to continue to farm land in that situation. Also, there's the risk of chemical contamination of soil, water and crops, and ultimately that may end up in the foods that we eat. Spill incidents often as well can have quite big impacts on animal health. So lastly, climate. I think we've just heard quite a lot about that, and this is a fossil fuel, make no mistake. When I first heard, when I always used to think of gas as sort of a bit of a green fuel, until I learnt about this industry. It's a potent greenhouse gas. Methane, which is what it comprises mostly, is 72 times more potent a greenhouse gas than CO2 over a 20-year time period. And several full life cycle analyses of unconventional gas show that you only need to lose between 2 and 4% of the gas in the sort of collecting and processing of it to basically wipe out any advantage that it has over coal. Current US EPA estimates of the sort of average fugitive emissions are 2.4% for America, but in Australia we haven't done any studies. I think CSIRO is undertaking one at the moment for CSG. But despite all this, the industry is very quick to claim that there's no health effects. But absence of evidence, as we know, doesn't equal evidence of absence. And in the 3 years that have passed since the Federal Senate inquiry, where DEA and others presented evidence and recommended independent baseline and ongoing water and air monitoring and so on, there's still no routine data being collected, even just of environmental monitoring of air and water. So, as far as independent studies go, they're small in scale and few in number, and population health studies are basically non-existent, even in the US, where there's about 500,000 wells, and the industry's been going strong for 10 years. So this is a paper published last week in the journal Environmental Science and Technology, and the authors conclude, despite broad public concern, no comprehensive population-based studies of public health effects of unconventional gas exist. And the authors also report that the US regulators are well aware that oil and gas development pose inherent environmental and health risks, and that the extent of these risks is unknown because the existing studies don't take into account the potential long-term and cumulative effects. So the risks are very obvious to anybody who looks. And the Medical Journal of Australia has also recently published an article on unconventional gas, harms unknown, and health uncertainties. So the risks, I think, are clear, and we really need to act on them, but without that sort of scientific evidence base, it's hard. Okay, thank you. So we like evidence, and I'm going to whiz through and show you a few bits of evidence that we do have now. So this is a paper that shows systemic methane contamination of drinking water, along with other hydrocarbons. This is one EPA study from Wyoming, which demonstrated that fracking chemicals had contaminated a town drinking water supply, and residents were advised to stop drinking the water. They had been experiencing health effects, and they were advised to only shower with the door and the window open so that they could have adequate ventilation and not breathe it in. Here in New South Wales, we've had a confirmed incident of an aquifer being contaminated by heavy metals and also uranium at 20 times the drinking water guidelines. This project's also had 16 spill incidents, including quite a large one, and they're trying to fast-track their approval through the New South Wales State Government. On air, this is a risk assessment using new SEPA guidelines, and it shows that there's increased cancer and other health risks if you're close to the gas well, and that those risks and also symptoms increase around the time of well completion, which is where they're fracking the well and getting the flow back. This is a study done in the Queensland CSG field on methane emissions, and there's 3 times the methane concentration in the atmosphere in a quite a very distributed area. So it doesn't look like just one leaking piece of infrastructure. It looks like there's a general increase in methane in that area where there's the coal seam gas field. And where methane's leaking from below, you can probably assume that there's other hydrocarbons along with their health impacts. Before I go to that, there's also been an asbestos incident in New South Wales, which was to do with a product that was being used that was contaminated. That's a case. This is the animal health impacts case series from overseas. That's quite shocking, really. So there's a lot of hurry, and it's a matter of what we can do further. DEA has been extremely engaged with this issue, as you probably know, and we've given dozens of talks all around the country and continue to be in demand. We've also written countless submissions, presented at inquiries, both state and federal, and so on. And really our messages haven't changed, and what we're asking for hasn't changed. The amount of evidence is increasing all the time, however. I think our advocacy is very valued by communities, and certainly they're struggling to stop the industry actually starting up in their areas. So we mustn't slow down with that, but I think we also need to look at other strategies as an organisation. And I've become interested and involved in divestment, which is really looking at a completely different tack, and I'm being hurried up, I know, it's very disconcerting. So we really, gas companies need 3 things to go ahead. They need social licence, they need government approval, and they also need money. So I think we're going to learn quite a lot more about fossil fuel divestment this afternoon, and I think I'll leave it there.
Thank you, Helen. Just one quick housekeeping message. We do have a full house today, so could everyone in future sessions please fill up all seats so that people arriving can also have a seat. Now, do we have any questions from the floor?
Jeff Pritchard. I'm a retired surgeon and I'm involved in a council in New South Wales at Tumut. Next Friday I have to go to Griffith in the Riverina for a Murray-Darling Association meeting, and we're going to be brainwashed by a government representative about the beauties of fracking. You're preaching to the converted really today. How do we stop it? I mean, the only answer I think is political. It's going to be one heck of a job.
Yes, well, we've been working on the political front pretty intensely, and I guess we have to have a multifaceted approach. We're continuing to try to do that. It's not easy, particularly at the moment. So I think we need to continue to empower communities to have their resistance. Grassroots resistance is really important. Education is really important, and the other thing is finance, because they all need big loans, these companies. So, and we all have money in banks, we all have money in super funds, and, you know, it's a way that every single citizen in this country can choose, you know, whether they want to support a fossil fuel industry or not. So, yeah, so we're just going to keep on doing what we're doing and more of it, and you know, I don't want to preface anything anybody else is saying from the organisation, but we are, we will have a whole range of speakers and talks available. So if anybody's interested in advocacy, they can join in.
Thanks for your talk. I was just interested in the legality regarding communities that have opposition to fracking operating within their city limits and surrounds, whether in Australia or in the United States and overseas.
I'm not sure about the situation overseas, but in Australia, a landholder is not actually, only really owns the first 10 centimetres of topsoil. Everything else is Crown property, and so there's no, landholders don't have the right to say no to any sort of mining activity in Australia. And there's mining leases all over the place. So that is a problem. Nonetheless, I'm not the best person to talk about this, probably a legal person from EDO, but my understanding is that an agreement has to be made between the landholder and the gas company in order to allow the activity to sort of occur on the land, and there has to be an agreement signed. So one of the ways communities have resisted the expansion of this industry is to actually decide not to sign those agreements and to get together and lock their gates, hence the name of that particular organisation. So community resistance is very important, and we've been asking, one of the things that we do ask for is that landholders have the right to say no. What's this fellow here?
Thanks, Helen, over here. Just wondering about the cost. Is it going to make us any money, that coal seam gas fracking, and if all the externalities are taken into account? And secondly, what about the fugitive emissions?
Yes, good. So, is it going to make us any money? Well, no. It'll employ a few people. The number that it'll employ is being drastically overstated by the industry, but. And the Australia Institute's put out a good discussion paper on that. Also, the thing about the companies is that they're largely foreign owned, more than 80% foreign owned. So all the profits, well, 87% of the profits are going to go to overseas shareholders. And in terms of taking the externalities into account, well, nobody's done that analysis for unconventional gas. I mean, I think if you did, you would be looking at an extremely expensive fuel indeed. There was one more.
One more question here.
I had the interesting experience in Western Australia when we put our names forward as a health organisation to speak at a national party organised meeting in the country, a place called Gingin, and the then Minister for Mines, Norman Moore, when he heard there's going to be a health perspective at this meeting, and it was organised by the National Party representative in response to local farmers who were concerned about this matter. When he heard there was going to be a health representative speaking, he said he would forbid his staff people to be at that meeting. Extraordinary use of political clout.
So he forbade his team from being there at the meeting because he heard that health was going to be discussed.
That's right. Yes. There was somebody on the health panel.
Quite interesting.
At a public meeting. Organised by a member of the coalition government, in fact, of the national parties.
Right.
But the question I did raise from the floor at that meeting, and although they didn't have me on the panel at the front, they gave me the opportunity to raise it from the floor, was that they have casings around these wells, and they really cannot give any guarantee, even the industry people could not give guarantee that over X period of time, 30 years maybe, they would degrade. That's what happens to concrete over time.
That's right.
And therefore, even though the well no longer is operational, the impact of that well may well be far greater than the period of its commercial life. Have you come across that particular problem in your discussions with the industry or anybody else?
Oh, yes, I've been at meetings where the industry's brought a little model of what it looks like and how thick the concrete is, and it's all really cool, looks great, and they sort of say, oh, it's great, we follow best practice and you can be safe with us and all of this. I think this is out in Western Sydney, actually, where they were proposing an expansion of a current coal seam gas operation. But my understanding is the same as yours, is that you cannot guarantee the casing, and there is also, with the rapid expansion of an industry, a high risk for errors, and certainly in other places like the United States, there's been a lot of cowboy operators or something, not literally cowboys, they could be, but just people who are sort of just in there for a quick make some money or something. Yeah, so that's a problem, and it won't go away, because once you've got the well there, you've got the well there, you've got the connection that goes vertically down through aquifers and then all the way down to the coal or the shale.
Just one last question.
Thank you. Why is it necessary to have so many wells? I've seen the pictures of the Pilliga important recharge area. Why is it necessary to have all those wells?
Because these are low quality, low permeability gas reservoirs. And you need to puncture them in many, many places to make it commercially viable. And you need to hydraulically fracture them and do all sorts of stuff like that. So conventional gas sources are more like what we have had in the Cooper Basin and things like that. It's more like you just put a well up, you put a well down and the gas comes up, simple.
Okay, thank you, Helen.
Of course.